Hello, my name is Jerry Price and I'm an instructor at HealthONE EMS. I'm here to demonstrate assessing a patient with a medical complaint. I'm going to put on my gloves for body substance isolation and check to make sure the scene is safe for me and my crew. I need to quickly evaluate the scene and the number of patients. I would then want to determine the nature of illness. If there is more than one patient, I would consider calling for additional resources. If there is any concern for trauma, I would want to provide cervical spine precautions. Once I am sure I am safe, there is only one patient, and I do not need to provide C-spine precautions, I can begin my primary survey. First, I would state my general impression. I observe an approximately 30-year-old female who appears to be in moderate distress. If the patient is conscious, I would introduce myself. Hello, my name is Jerry and I'm an EMT. I'm going to care for you today. Can you please tell me your name?
Lynn.
And how old are you?
37.
I have determined my patient is awake and alert. If the patient is unconscious, I would determine my patient's level of responsiveness by using the AVPU scale. Now I need to determine the patient's chief complaint. What can we help you with today?
I've just been not feeling good.
I will identify and address any obvious life threats. If the patient speaks without difficulty, I have determined the airway is patent. If the patient is unable to speak or is unconscious, I assess the airway for patency by looking, listening, and feeling for breathing. I ensure adequate respiratory effort and ventilations and assess for breathing adequacy, rate, tidal, volume, and effort. At this time, I will initiate an appropriate oxygen therapy. To complete my primary assessment, I need to assess for the presence of a pulse. If the patient is unresponsive, I would check the carotid artery. If the patient is responsive, I would assess the radial artery. I evaluate the approximate rate, strength, quality, and rhythm. I need to control any obvious life-threatening bleeding and assess skin condition, including color, moisture, and temperature. Now that I have completed my primary assessment, I can determine the patient's transport priority. I have determined that the patient is a low priority and will require a non-emergent transport. History taking is an important facet of assessing the patient. To accomplish this, I will question the patient for the pertinent history of the illness or chief complaint. What were you doing when the problem began?
I wasn't doing anything particular, just started not feeling good.
Lynn, does anything make it better or worse?
Just how I sit. I kind of have to lay up a little bit at night to try and sleep.
Can you describe to me what this feels like?
Just best I can do, stomach cramping.
Does the pain or the uncomfortableness go anywhere, or does it stay in one place?
Generally one place.
Lynn, on a scale of 1 to 10, how bad is this problem today? 1 being the least amount of pain, and 10 being the absolute worst pain you have ever felt.
5 to 7.
Lynn, can you describe to me what we would have to do to recreate this feeling?
A punch in the gut.
When did this feeling start?
A couple days ago.
Lynn, can you tell me anything more about your complaint? I also need a good understanding of the patient's past medical history. Using sample, I can quickly understand what that history is. S is signs and symptoms. I will observe for obvious signs of trauma. Do you have any allergies to food or medications?
None that I know of.
Do you have any medications? They can be prescribed medications, over-the-counter, vitamins, herbal remedies, recreational drugs, or birth control.
I take Allegra.
Has this ever happened before?
Yes, from a visit to Mexico.
What and when did you last eat or drink today, Lynn?
I've been doing sips of water and ice chips and a couple crackers. That's about it.
Has anything else happened that led you to call for assistance today?
It's not going away.
Secondary assessment is a focused look of the body part or system relating to the chief complaint. This could be cardiovascular, pulmonary, neurological, musculoskeletal, gastrointestinal, reproductive, or psychological and social issues. Now that you have an idea of physically what is happening with the patient, you need some data to help formulate your field impression. Obtaining vital signs may help you fill the gaps of your assessment. I will complete a full set of baseline vital signs: pulse rhythm, pulse quality, blood pressure, respiratory rate, respiratory quality, lung sounds, and pupillary response. I have completed my physical assessment, history, and vital signs. I can now form my field impression. My field impression of this patient is that she's an approximately 30-year-old female that is suffering from nausea and vomiting for 2 days. During transport, I will reassess the patient. This step lets me know if my care is working, noting or correcting any situation I discover. Finally, I give my radio report. That is how you perform a medical assessment. Obtaining details of the patient's complaint, whether it is an illness or an injury, is crucial to developing a plan of treatment and ensuring the patient has the best possible chance of improving. Good luck and stay safe.